Patients often ask, how do I know I need a root canal treatment? Hi, I'm Dr. Elyssa. I'm a root canal specialist here at Dental Designs Clinic in Singapore. Patients often ask, how do I know I need a root canal treatment? Firstly, there are visible signs that we can look out for. Some patients may present with gum boils, like a little pimple in your gums where there's pus coming out, a dental abscess, or a discolored tooth. They may or may not be able to tell because some patients simply don't lift up their lips to check so closely in the mirror. And such signs may or may not be associated with pain. Secondly, how we check is there might be some infection associated with the root canals. Sometimes when we look at x-rays, we can find a root canal infection on the tooth. Let me show you an x-ray to demonstrate. So this is an x-ray of the lower right molars, closer towards the front known as your premolars, your first molar and your second molar. So for healthy teeth like this premolar and this molar, you notice that the roots that we are looking at here has a very intact ligament. It looks like a border outline, same for this one over here. And the bone around it is healthy. This is your bony trabeculae looking quite alright. Now spot the difference. For your second molar over here, if you just look at the roots itself, you can tell that there's a black bubble here. So what happens is that this tooth actually had some sort of an infection through a crack despite placing a temporary crown. And when the bacteria is built up inside the root canal system, it tries to be contained by your body, causing a localized infection over here, which destroys the bone, as if there is a black bubble here. So you can tell that the bone here is less solid, appearing as if there is a hole in the bone. So such cases may or may not show up in the mouth as an abscess or present with pain. So only when we take x-rays can we find out that this tooth has a root canal infection. So how can we treat such cases? They are very simple. Root canal treatment can solve the problem. I'll break down root canal treatment into two components. The first would be stage 1, which is known as cleaning and shaping. The aim of this treatment stage is very simple. What we want to do is to open up the root canal system to clean it mechanically using small brushes and also chemically using some medicine. So if you can imagine, if your tooth has a decay, bad fillings, we will remove it and then we'll create a small little keyhole access to your root canal system. So these are known as endodontic files, but I like to call them little brushes. So imagine when we are using our toothbrush, we clean the external surface of the teeth when we are brushing our teeth. These little brushes are actually going deep into the root canal system to brush the sides of the root canals to remove the debris, bacteria or any infected tissues inside. Then finally, we'll use some medications or some chemicals to flush it out and disinfect it. So for this stage, in layman's term, we usually call it the disinfection stage, where we want to create a healthy environment such that our body can return back to health and allowing the gum boils, pimples to resolve quite nicely. Then now let's go on to stage 2. Stage 2 is usually known as the root canal filling stage or known as obturation. So can you imagine after doing stage 1, your tooth is clean, healthy, and the gums are all nice, cured at this time. So for this second stage, what we'll do is we'll fill the tooth up with our material to seal it up such that bacteria doesn't go back in. And thereafter, we'll place a foundation. In terms of the foundation, some patients can go for a simple filling like this, or sometimes we may need to put a little rod inside the tooth to support the filling if the tooth is quite broken down. It is actually called a post, and if you want to talk about it in layman's term, I'll call it a foundation. Most of these teeth will then require a crown, especially if they're your molars at the back. So we require you to go back to your general dentist as early as possible, put a helmet on the top. Most of the cases that I see for root canal treatment tend to be very broken down, either because of an old filling, a bad decay, or simply cracks on the teeth. So this is a simple video to let you know more about root canal treatment. Even if you're not having any pain, I would suggest you can visit your dentist for a routine checkup to make sure that your teeth are in healthy shape. So you might pick up small little signs like if you're having a gum boil but you have not noticed it, a slight discoloration to your tooth, or simply during the routine x-rays they find out that hey, there's a black bubble on your tooth root indicating a root canal infection, then that's when you need to come in for root canal treatment. So if you want to come down to Dental Designs Clinic for root canal treatment, we assure you that it's going to be gentle and predictable. See you soon!